Today is American Diabetes Association Alert Day. In honor of the day, the American Diabetes Association is asking adults to take a 60-second type 2 diabetes risk test. Type 2 diabetes is the most common form of the disease, which occurs when your body does not use insulin properly. Type 1 diabetes is usually diagnosed in children and young adults. Only 5% of people have this form of diabetes. Diabetes type 2 is much more common.
Yeah, and Dr. Deere is here with us today to talk about the American Diabetes Alert Day today. First off, what do you have to do to take this test, type 2?
So there is a risk calculator online at the American Diabetes Association website that asks a very quick series of questions that screens for risk factors for diabetes. This is only a risk calculator. In order to actually get screened and diagnosed for diabetes, you do have to visit a local health care clinic.
And it's really just a blood test, right?
It is.
Yeah, easy enough. And they can tell just immediately if you have diabetes from that test?
We can. There's a few different criteria that we use to diagnose type 2 diabetes, and sometimes we can do it with just a simple prick on the finger, not necessarily getting a blood draw, which I know discourages people from accessing care sometimes.
What are some of the symptoms of type 2 diabetes?
Sure. So sometimes people won't have any symptoms at all. Other times people will develop abdominal pain, they'll have increased thirst, they'll need to use the restroom more frequently. Those might lead a clinician to screen somebody for diabetes in the office, but oftentimes people aren't aware that they have impaired glucose tolerance.
You mentioned risk factors. There is a way to prevent the onset of type 2 diabetes. Tell us about the risk factors and what you can do to lower your risk.
Correct. We know type 2 diabetes is associated with lifestyle factors. So when we talk about preventing diabetes, we look at weight, so maintaining a BMI lower, that's less than 25. Body mass index is a measure of your height to weight ratio. We look at controlling issues like high blood pressure, high cholesterol, and then healthy eating and having an active lifestyle we know can prevent the onset of diabetes. And then when we're treating diabetes, following a healthy diet and exercising on a regular basis can also help us control diabetes and sometimes get by without having to use medications.
What about family history? Is that a factor for type 2 diabetes?
It most definitely is, although there's not a direct genetic correlation where we can predict if one will acquire it or not, but we do know that if you have a first-degree relative who has type 2 diabetes, that it does place one at increased risk.
Give us an idea how many people in the country have diabetes. How common of a disease is it, and how debilitating can it be?
Sure. So according to 2014 statistics from the Centers of Disease Control, approximately 29 million Americans have diabetes. That incorporates type 1 and type 2 of diagnosed cases. 21 million know that they have it. That means there's 8 million Americans living with diabetes who have not been diagnosed yet.
What about treatment for diabetes? I know you talked about how you can reduce your body fat, also physical exercise and your eating habits, eating healthy. But what's the treatment if you are diagnosed with type 2?
Correct. So sometimes, depending on how advanced the disease state is, we can get by with lowering blood sugar with rigorous diet and exercise. Oftentimes, however, we recommend that patients start with oral medication, and then we check blood sugar levels every 3 months approximately to see how they're responding to the medication. In some more advanced cases, we have to use insulin, which is a replacement of a hormone that the body uses naturally to help get glucose into our cells.
And I guess the whole point of getting tested is it's important that you know you have it, because if it gets out of control, it can cause debilitating, life-changing symptoms, even death. You could lose, your limbs, your eyesight? Tell us about that.
Correct. We can't underscore enough the importance of treating diabetes and getting good control of blood glucose levels. Elevated blood sugar levels can lead to damage of other organs, including our eyes, our kidneys. It can cause nerve damage and put us at increased risk for heart attacks. And often we don't catch how advanced the diabetes is until it's too late, and there are signs of what we call end organ damage.
Yeah. So, okay, the big thing today, though, is it's Alert Day for type 2 diabetes. You go onto the website. Tell us about that. Where do you go to take that test?
Correct. So we go to the American American Diabetes Association website, and even if you Google the ADA Type 2 risk calculator, it will take you directly to the link. And I took the test myself before I came on air, and it takes about 2 minutes or less.
Did you check out okay?
I did.
Okay. That's good to hear. Dr. Melissa Deer, you are the Chief Medical Officer at San Diego's American Indian Health Center. Thank you very much for chatting with us today. Appreciate it. And we'll have all that information and the link on our website at KUSI.com.
All right. Good to see you. Thanks a lot.
Thank you so much.